BLIGHT is a doctoral network funded by the European Union with the goal of improving biomedical diagnosis through photonics and artificial intelligence. For this to be achieved, we will provide top-level training to 11 researchers with the objective of improving the understanding of diseases in three main research areas: analysis of cells and tissues using microscopy techniques, eye diseases, and cardiovascular health.
In my research, I'm interested in how neurons inside the eye respond to and transmit information about the visual world all around us to the rest of the brain. So in this project, we're going to use a mixture of experiments and computer simulations to try and understand how the circuits in the retina work and how they encode visual information.
At birth, the visual system is immature and requires typical visual experience to keep developing. The visual cortex needs to receive aligned and focused retinal images. If this doesn't happen, the children are at risk to develop problems such as amblyopia. Usually, these conditions are detected or diagnosed too late, and then the treatment is difficult.
In our project, we want to measure the ocular movements using an eye tracker in order to improve the diagnosis and the treatments of different visual anomalies like amblyopia, like strabismus and others, and also incorporate the machine learning and the artificial intelligence.
Our researcher will work in technology based on eye tracker for early diagnosis and risk factors study of abnormal dysfunctions of binocular vision.
The goal of this project, at least from our point of view, is to focus on improving the management of those patients with problems with binocular vision. So the early diagnosis and the management would be the main goal of our participation in the study.
In the framework of the BLIGHT project, we will build a multispectral imaging device in order to help in the diagnosis of retinal diseases. It's important because the retina is a very important structure of the eye that allows us to have a perfect vision. We will obtain morphological information from them. So we will mix this spectral and morphological information using deep learning algorithms in order to improve the diagnosis and to help ophthalmologists in a difficult diagnosis of retinal pathologies.
In BLIGHT project, we are going to develop a tomographic microvibrography method. And so the method is based on sensing of the small deformation of the tissue through optical coherence tomography modality, and to stimulate the tissue with the ultrasound. And this will enable to determine viscoelastic or biomechanical properties of ocular tissues, and should aid early diagnosis of ectatic diseases such as keratoconus.
Our research focuses on defibrillating the heart, controlling cardiac arrhythmias with light. And we can do this because the heart is optogenetically modified and sensitive to light. And this helps us to develop novel techniques to control lethal cardiac arrhythmias with very gentle light pulses.
In the BLIGHT project, we plan to develop new techniques to analyze biomedical images or complex images. And the idea is try to detect changes in the data, changes in the images, or changes in the signals that might be that might be a signature of some disease or some critical transition ahead. So, for example, if there is some arrhythmia, if we are monitoring the heart, maybe we will be able to infer or detect with certain probability the possibility of this coming transition, which obviously we want to detect in advance.
we will try to develop a system that will produce multimodal images, for example, thermal, near-infrared and visible light images. Then we will apply deep learning algorithms to obtain some very important diagnostic information, for example, about some perfusion maps, about skin abnormalities and other related medical information.
Our lab develops new functional and molecular imaging modalities based on optical and ultrasonic approaches, and also some multimodality techniques. In this project, we will develop new approaches based on multispectral optoacoustic tomography to do early diagnosis of cardiovascular disease, in particular carotid artery disease. So our goal would be to detect early the vulnerable plaques that are responsible for most of the stroke cases.
In our group, we are an expert in super-resolution fluorescent techniques, and one of these techniques is super-resolution optical fluorescent imaging, or SOFI. In SOFI, what we do is analyzing the fluorescent fluctuation of the emitters to produce, by some mathematical analysis, an image of a super-resolved image. In the context of this project, what we would like to do is to improve the performance of the SOFI analysis. And this would be achieved with deep learning and machine learning.
Our group is working in super-resolution microscopy, and we want to decipher the functionality and organization of synapses. And for doing so, we use super-resolution microscopy, and we also try to develop new techniques to go further into details, so to see really the tiny parts. So we are in the moment combining a microscope technique like calling expansion microscopy, where we physically expand a specimen before imaging. Therefore can really resolve tiny structures like about 1 nanometer size.
Regarding our project, the primary objective is to combine the super-resolution technologies with machine and deep learning to improve the diagnosis of rare disease. When we apply these technologies, the differences in collagen fibers become more evident. The idea is to build a super-resolution image database and to create a convolutional neural network that assists us in classifying the patient and control samples, and to create a pipeline that is applicable for any rare diseases.